everyone, my name is Christine Bulitresi, but you can call me Ma'am Christine today. I am studying at Tasmania College's Masbate City, Bachelor Elementary Grades, and I am second year college. Now, I will be your teacher in the subject of Health 5. I hope you will learn something from what I will teach. And now,
good morning, students! Can I suggest who can lead our prayer this morning? Okay, Miguel, please all stand. Thank you. And now, before we start this morning, we will have a warm-up exercise. Please all stand, everyone. Thank you everyone for your participation, and now we proceed to check the attendance. Raise your right hand if your name is called, okay? Miguel Alto, Antonio Arado, Nadites John, Cinco Raymar, Alcuvindas Balatukan, Grace Pelim, Paulina Rapera, and Develyn Sampaga. Kompleto ang lahat. Good morning again, students. Okay, thank you. And now, before we start our lesson, there are 3 rules in my subject. Rule number 1. Your attention should be on me as I teach in front of the class. Rule number 2, when I have a question, I need someone to answer. If no one, I will ask you one by one. And rule number 3, listen when someone speaks in front of your fellow students. Is that clear? Okay, very good. Last week, we studied about first aid kit. Am I right? Okay. If you still remember anything that you have learned about first aid kit, give an examples. Yes, Miguel. Very good. Another answer. Yes, Alcuvindas. Very good. All of your answers is correct. Now, I know you all remember some of the discussions about last week. Before we move to our discussion, I will show you some pictures. Are you guys ready? Okay. So this is the other examples. Okay, class. What do you think in the pictures? Yes, Miguel? Very good. Do you think there is a cure here to get rid of the pain? Yes, princess. Very good. And last question, based on the pictures you saw, have you experienced this? Okay, all of us have experienced this kind of situation. I think you can easily understand our lesson today. And I know that you are already familiar with what I am going to mention. So this morning, our topic is all about first aid for common injuries and health conditions. So the first common injuries is wounds. Can you please read, Princess? Thank you, Princess. So, sa madaling salita, ang wounds daw, ito daw ay sugat. Nagkakaroon naman tayo ng sugat kapag tayo ay nadatapa or sumabit ang ating balat sa kung anong bagay katulad na lang ng wire. So, may dalawang uri tayo ng wounds. Una, laceration, and ang pangalawa is abrasion. Ganyan ang itsura ng laceration. At ito naman ay ang abrasion. Ang laceration, ito yung may hiwa. Tapos ang abrasion naman kapag malaki na yung sugat. So, ang next naman is nosebleed. Nosebleed occurs when the blood vessels in the brain. Most nosebleeds pose no serious harm or medical condition if they seldom happen. So, sa madaling salita, nagkakaroon lamang ang tao nito kapag may problema sa health. Sino naka-experience dito? Wala? Okay, edi mabuti. So, next is insect bites. Insect bites are mild and usually manifested by redness, itchiness, stinging sensation, and minor swelling of the area affected. So, sa madaling salita, nagkakaroon lamang tayo ng insect bites kapag kinagat tayo ng insekto. Tapos, kapag kinagat tayo nito, namumula ang parte ng kinagatan ng insekto. Kaya dapat, kung kakagatin man tayo ng insekto, huwag natin to hamutin para hindi siya maglala. Lahat tayo naka-experience nito, di ba? Halos lahat tayo ay naka-experience na nito. So, ang susunod ay animal bites. Animal bites and scratches from animals that break the skin need to be cleared immediately using soap and running water. Sino naka-experience na neto na kagatin ng hayop? Wala? Si Miguel naka-experience na daw. Wala na? Okay, so Miguel naka-experience ka na nito, di ba? Anong ginamit mo na gamot para mawala kaagad yung sakit ng kinagatan ng hayop? Tama. Kaya nga sabi dito, dapat using soap and running water. Yun yung mabisang pampatanggal para mawala yung sakit ng kinagatan ng isang hayop. Attention should be given especially when bites are from dogs, cats, rats, and bats, as these are potential carriers of rabies. Kaya dapat, kung kinagat tayo ng hayop, dapat agad-agad natin ito gamutin para hindi lumala ang rabies. So, next is burn and scald. Burn and scald are damage to the skin caused by heat. So, ang burn and scald daw, ito daw yung nadadamage yung ating balat sa pamamagitan ng init. And treated differently from other type of wounds. So, burn is an injury caused by dry heat such as fire, any hot materials such as cooking utensils, or even the sun. So, nagkakaroon lang tayo ng paso kapag tayo ay napaso sa isang bagay na mainit katulad ng mga kagamitan sa kusina kapag tayo ay nagluluto. Tapos, kapag tayo ay napaso sa init ng araw, yun ay tinatawag na burn. Next is scald. Is caused by wet heat like steam, hot water, or cooking oil. So, nagkakaroon tayo ng scald kapag napaso tayo sa mantika. Ganito yung magiging kalabasan ng sugat niya. Sa loob nito ay may tubig-tubig. Yan, ganyan siya. Kaya makikita mo talaga ang difference ng burn and scald. Kasi ang burn, ganito siya na itsura, na sugat. Tapos ang scald naman is ganito. Naintindihan po ba? May tanong po ba about dito? Wala? Alam ko na naintindihan nito kasi wala kayong tanong. Okay. So, next is food poisoning. Food poisoning is a foodborne illness. It occurs when the food or drink consumed is contaminated with bacteria, parasites, or toxins. So, sa madaling salita, ang food poisoning, nagkakaroon lamang ang tao nito kapag nakakain ng expired na pagkain or ibahan na yung lasa niya. Nagkakaroon ng food poisoning ang tao kapag hindi kaaya-aya yung kinain. Katulad na lang pag may pagkain na bacteria sa loob nito, tapos toxins. Yun yung food poisoning. Next is fainting. Fainting is a sudden and generally temporary loss of consciousness due to lack of oxygen in the brain. So, sa madaling salita, sa first sentence, ang fainting daw ay nagkakaroon ng temporary loss of consciousness due to lack of oxygen in the brain. Una talagang makapektuhan nito ay yung utak natin kasi kapag nahilo tayo, utak talagang gumagana sa atin. And next, as blood supplies oxygen to the entire body, fainting occurs when the blood supply to the brain becomes inadequate. This usually due to dehydration, heat exhaustion, low blood sugar, and sometimes even emotional stress. So sa madaling salita, nagkakaroon din ng isang tao ng fainting kapag sobrang stress na, marami nang iniisip, tapos hindi kumakain sa tama. Kaya nagkakaroon ng fainting ang isang tao. Naintindihan po ba? Sino na naka-experience dito? Ikaw o si Princess daw naka-experience na daw nito. So, Princess, tatanungin kita. Anong ginawa sa'yo nung nahilo ka? Tama. Dapat, kapag nahihilo ka, mag-inom or painumin ka ng tubig para magising ka or mabuhayan ka. Wala na po ba? So, naintindihan po ba ang ating discussion ngayong umaga? Mabuti. So, If you understood something we study, what is wounds again based on your understanding? Yes, Miguel. Another answer? Yes, Rapera. Very good. So, next question. What is the difference between nosebleed and wounds? So, matawag ako ng pangalan kaya walang nagtataas ng kamay. Balatukan. Yes. Very good. Another answer? Wala na? So, next question. What was your lesson in our discussion this morning? Wala na naman masagot. So, matawag ako. 5. Please stand. Very good answer. So, another answer? Wala na? Last question. For you, how can you keep yourself careful so that you will not be injured or have weakness in your body? Walang masagot? O, sige, matawag ulit ako. Alto Antonio. Okay, thank you. Very good class. I know you understood our discussion in this morning. So, we proceed to our group activity. So, for group 1, create a scenario that shows a family is eating dinner and suddenly their youngest child's stomach hurts after eating. So, sa Tagalog, gumawa daw ng senaryo na nagpapakita ng isang pamilya na habang kumakain ng gabihan ay biglang sumakit ang tiyan ng kanilang anak pagkatapos kumain. Then, group 2, create a scenario that shows that while you are playing with your friends, one of you is bitten by an animal. So, sa Tagalog nito, gumawa ng senaryo na nagpapakita ng naglalaro kayo ng mga kaibigan mo, tapos may isa sa inyo ay kinagat ng isang hayop. Naintindihan po ba? Okay. So, next, last group, create a scenario showing a student bleeds his nose while in volleyball practice. So, sa Tagalog, gumawa daw ng senaryo na nagpapakita na habang naglalaro or nag-practice sa volleyball ay nagdugo ang ilong ng isang estudyante. Naintindihan po ba? Okay. Wala na po bang tanong about dito sa group activity? Wala na? Okay. So, this is the criteria/rubrics. Yan. Dito ako mabase ng score nyo. Pakisulat na lang sa 1/4 sheet of paper para may guide kayo sa pag-create ng scenario. May nagsusulat pa po ba ng criteria para sa group activity? Meron pa po ba? Hello, students! Meron pa po ba? Okay, wala na. So, may tanong po ba about sa group activity? May tanong po ba? Wala? Did you understand what you were going to do? Okay, I know each of you can do it. Then, if your group gets a high score, you are exempted from the quiz next week. Okay, is that clear? So, each group must be efficient and organized. So, I will give you 30 minutes to prepare for the group activity. Okay? Is that clear? You all may start now. Thank you for your participation. You are all very good. Let's clap our hands. Later, I will tell you which group get the highest points. Did you understand? Please be quiet. Okay. Now, we will have another activity, but individually. No copying with classmates. Did you understand? Okay. I will give you worksheet to find out what common injuries and health condition it is, if you still remember them. So your answer, write in this side. Okay. Is there a question? Nothing? Good. I will give you 5 minutes to answer the activity and you will pass it to me after, okay? You all may start now. Okay, class, time's up. Pass your worksheet forward. Okay, so for your assignment, search for another example pictures about common injuries. Place it on the 1/8 illustration board and to be passed me tomorrow. And study the first aid guidelines and causes, page 451 to 456 in your health book. Did you understand? Okay, may tanong po ba? Wala na? So, thank you and God bless. So, pwede po ba tumayo muna tayong lahat para sa panalangin natin? Princess, pwede ikaw na lang ang mag-lead. Goodbye, class! See you tomorrow.